When it comes to hip impingement and anterior hip pain in general, we often talk about posterior capsule flexibility, glute med and min weakness, but no one ever really mentions the effect the rectus femoris muscle has on the anterior hip. The rectus femoris is a two-joint quad muscle, meaning it attaches from the hip, the pelvis, to the knee, so it helps flex the hip and extend the knee. Now, what's interesting about this muscle, it has two different origins at the hip. One origin is on a bony prominence at the pelvis, known as the anterior inferior iliac spine, or the AIIS for short, and the other is what's known as the reflected head of the rectus femoris, which inserts into the anterior capsule and acetabular rim. In my mind, any muscle that attaches close to the hip capsule can affect the load placed on the labrum and the sensitive joint structures themselves, like the capsule and the ligaments surrounding the hip. Most research shows that rectus femoris force production isn't really limited in cases of hip impingement. We'll commonly see muscles like the iliopsoas, the adductors, the glute med and min, the hamstrings even, that show more force production loss. And these are muscles that we would commonly strengthen. But the issue with this research is the rectus femoris isn't trained in both the long and short ranges. So in this video, we're going to go through 3 of my favorite strategies to help not only release some protective tone in the rectus femoris, but help strengthen them in the long and shortened positions. But I want to give a little bit more explanation into the why before we get into the exercises. Since the rectus femoris attaches directly to the front of the pelvis, when it gets stiff and really guarded, it'll pull the pelvis into an anterior tilt, which, like I mentioned, can compress the front of the hip over time. Now, anterior tilt, I've talked about posture many times. It in itself is not dangerous, and it's not something you need to worry about. We all have some degree of anterior pelvic tilt at rest. If the front of the hip is constantly feeling stiff, then it's telling us that this muscle is guarding. I do find when a muscle has this kind of variability in its range of motion, where it's strong in both the lengthened and shortened ranges, then static postures aren't really issues anymore. If we are experiencing front of the hip pain with hip flexion and extension, then we don't want to stretch these muscles, because a lot of times these front of the hip muscles are guarding because of pain. And when we stretch, this is a threat response to the nervous system. Our muscles are guarding because they want to be protected. This anterior hip is irritated, so stretching these tissues is going to further irritate them. So this is a very important concept, because when we get into these exercises, we're not going to do direct stretching for the front of the hip. Instead, we're going to perform exercises that help reflexively release some of that protective tone in the rectus femoris, and then we will load the rectus femoris, the distal fibers toward the knee at length, which will help us get a stretch through the whole muscle but not irritate the front of the hip. And then we will load the rectus femoris in the shortened range, more specific to a squat and more specific to a seated position where we commonly get hip discomfort. And we'll do so in a way that coordinates that muscle function with some of the other hip flexors, like the adductors and the iliopsoas, as well as the lower abs, to help stabilize the pelvis. So let's get into it. Okay, this is the half-kneeling block crush, a staple exercise that you could find in my Supple Hips program for improving hip extension and knee flexion. The idea of this exercise is to load the hamstrings in the shortened range of hip extension and knee flexion to reflexively release some protective tone in the quad muscles, specifically the rectus femoris. So you're going to set up in half kneeling with some sort of surface in front of you. It could be a table, a box, something you can push into and create some isometric tension within the trunk. Now, variation 1 is going to be using a yoga block, and you're going to crush the block between the butt and the heel. Once you have a good crush on that, then you're going to want to extend the hip so the hip is at least in line with the knee. Ideally, we can get it a little bit further in front without the low back arching. Okay, push down on the box to keep a strong trunk engagement, keep the abs on. Okay, and we're going to push for about 5 seconds. 5, 4, 3, 2, 1. We can relax that hip position. Extend the hip. Push. 5, 4, 3, 2, 1. It's very common to cramp in the hamstrings here. I'll do one more rep. And push. 5, 4, 3, 2, 1. Good. So then we're going to release the block. And then we're going to move into more of a hip flexor stretch like this. Okay, and then we're just going to do some unloaded lift-offs here. So after flexing the knee, try to extend the hip a little bit more. So perform about 8 to 10 lift-offs there, and you'll notice you'll be able to sink into much deeper hip flexor stretch. If you're not flexible enough at the knee to squeeze the block, then what I like to do is have a band anchored on a squat rack and just put that around the entire foot. So you can set up in your half kneeling position, isometrically push against the band. Okay, about 5 seconds. Okay, so you'll do your 3 to 5 reps. Remove the band, and then you can do your unloaded lift-offs. If you do have anterior hip pain, then like I mentioned in the beginning, I'm not going to want you to stretch super far into hip extension with this. So that's why when we're performing these lift-offs, I want you to keep the ribs down, because any excessive lumbar extension will place a little bit more stress on the anterior capsule. Fine if the hip is feeling good, but when it's irritated, that's not going to feel good. So when you're doing the lift-offs, instead of extending the hip fully, just keep the ribs down and just perform these small lift-offs like this, and you'll still get a good tension relief effect without irritating the front of the hip. A really nice exercise to reduce some protective tone through the quads and hip flexors and improve some hip extension. And now we can load the rectus femoris muscle at length using a single leg reverse Nordic curl. Why I like the single leg variation better than the double leg variation is because we can keep our pelvis a bit more stable and really focus in on one side at a time, compared to the double leg, where there's a huge tendency to arch the back and thrust the hip forward. When we keep this half kneeling position, we can lock the pelvis into a little bit more of a posterior tilt a bit easier. And we can go through less range before feeling a massive stretch in the quad here. Now, why I prefer the reverse Nordic compared to something like a wall quad or a couch stretch in this context is because this variation is going to load more of the distal quads, and it's going to create more of a stretch down there, while of course still loading the full muscle, as opposed to a bent knee hip extension stretch where we're moving through hip extension. We're getting much more load through the proximal rectus femoris hip flexors here, which can stress that anterior hip if it's a bit more aggravated. So we can use a cable or we can use a band just to help offload here. Now the first variation is going to be an isometric. When it comes to foot position, we can go toes pushing into the ground, which is going to make it a bit more challenging because that pre-positions us in a bit more knee flexion from the start compared to toes down, which makes the shin a bit more parallel to the ground. But I like this because this allows us to go through less range. So get some good tension on the band, crunch down, ribs down, push the pelvis forward, extend back, and then I'm just going to crush my toes through the ground while maintaining hip extension here. So I like to hold this position about 45 to 60 seconds here. Deep breaths here. Okay, so anywhere from 3 to 4 sets of 45 to 60 seconds will be a great stimulus for the quads. And you'll find the isometrics in general have a really nice effect of getting these stiff and guarded muscles to relax over the duration of the time that you're holding. Okay, lastly, we can load the rectus femoris in a more shortened position. And this is actually one of my favorite exercises to get the rectus femoris working in conjunction with the lower abs and some of the other hip flexors like the adductors and the psoas to help control hip flexion. Now we're going to get into this bear plank position with our feet on the wall. Okay, this is going to actually mimic kind of a squat position. So if you do have anterior hip pain with a squat or sitting for prolonged periods of time, this could be a very powerful drill to help reduce some of that pain and help build some capacity in the front of the hip. When we go into a loaded squat, yes, we're loading the quads, but we actually don't get a lot of rectus femoris activity. The only way we really stimulate this muscle commonly in the gym is with a seated leg extension exercise, where the hip is fixed into flexion and the knees are extending. Now, this isn't very specific to our end range of motion, and like I mentioned previously, we don't get that coordination effect where the rectus femoris gets to work with the adductors and the lower abdominals. So let's demonstrate the exercise. We're going to take a block and we're going to squeeze it. Now, if you do have some intense hip pain, especially with adduction, then go ahead and squeeze the block in the wide direction. Okay, so from here, we're going to lift the knees up, heels pressing into the wall, and then I'm going to sit the hip back. Okay, and then come back out of it. So getting some knee extension. The entire time, we're crushing the toes down into the floor. And as you sit back, you're really going to feel that front of the hip working hard, especially as you squeeze the block. So I like to go for about 8 to 12 reps here, and then finish with a little bit of an isometric hold here at the bottom. Anywhere from 10 to 20 seconds. Now, you want to make sure that you keep the posterior pelvic tilt so you get those abdominals working as well. This is actually a really good core exercise. But if you want to bias more of those hip flexors and isolate the rectus femoris a little bit more, we can keep an anterior pelvic tilt. And we'll feel that front of the hip working even harder. I'm sweating right now. Whew. Okay, now this is a really nice one to do a test-retest after. You can bring your knee toward your chest. Ooh, that actually feels quite nice. You could even retest the squat. And very often the squat is going to feel much more opened up once you get the rectus femoris working in that shortened range of motion in hip flexion specific to a seated position or even a deep squat. Okay guys, that's the video. If you struggle with anterior hip pain, let me know what you're experiencing in the comments, and let me know what you want me to make a video on next in regards to hip pain and hip mobility. If you haven't already checked out my Supple Hips program, this program will have you covered with all the ranges of motion the hip goes through. It's a comprehensive mobility program filled with over 30 bang-for-your-buck exercises. I have all the answers laid out for you. All you have to do is execute. If you haven't subscribed to the channel yet, please do. If you're interested in more out-of-the-box creative mobility ideas that are experience-based. If you enjoyed this video, share it with someone and give the video a like. Stay supple.